Hello viewers, my name is Dr. Linda Nyamute and I'm a consultant psychiatrist at the Isiolo County Referral and Teaching Hospital at Isiolo County. I'm also an active mental health advocate and the founder of the Mental Sphere platform, which is an online platform for creating awareness on mental health and mental health disorders. We do know that during this time of COVID pandemic, we've had a number of mental health issues coming up, and today we are going to talk about quality of sleep and how we can improve our sleep and prevent poor sleep, basically. So join me as we begin this session today. So just to begin, we're going to talk about sleep disorders, and we do know that sleep disorders, particularly during this time of the COVID pandemic, have been exacerbated by the lockdown period. People were unable to travel within and out of Nairobi for some period of time, and this caused a lot of anxiety, particularly to do with not knowing whether you'll get the illness and everything behind what the illness is about and the kind of disease progress that the illness had to give. So of course this led to a lot of stress. Yeah. So when you talk about sleep, good sleep quality, what does good sleep quality entail? We have quantity of sleep. And sometimes we may confuse quantity of sleep and equate it to quality of sleep, but this is not the case, because someone can sleep for 8-9 hours, some even 12 hours, and they wake up feeling not refreshed. Therefore, quantity of sleep does not equal good sleep quality. So what equals good sleep quality? It's determined by a number of factors, and I'm just going to list them down. So we do have sleep latency, and this is basically the amount of time it does take you to fall asleep. So once you get into bed and you're ready, you've switched off the lights, you're ready to sleep, how long does it take you to actually fall asleep and start sleeping? So the normal sleep latency is less than 30 minutes, and after 30 minutes, it's assumed if you do have good sleep quality, you should have fallen asleep by then. So the other thing, the quantity also matters. Sleep duration. For normal adults, 7 to 9 hours is deemed good sleep duration. A lot of people do sleep for lesser hours for whatever reason, maybe due to shifts, night shifts or day shifts that are coinciding with a lot of other activities. But the normal sleep hours for adults is 7 to 9. For children, it's a bit more. For the older adults, it gets a bit lesser. The other thing that will determine your sleep quality is sleep disturbance. This basically is how many times you wake up in the middle of the night to either go to the bathroom or for whatever reason you just woke up out of the blue. So this should not be more than once per night. And the other thing about sleep quality is once you wake up, you're able to fall back to sleep at least within 20 minutes after you waking up. Sleep quality also is determined by the use or no use of sleep medication and enhancing drugs. Sometimes people also use things like alcohol or marijuana or even prescription medication to try to get them to sleep. So using sleep medication, or rather needing sleep medication in order to fall asleep is a predictor of poor sleep quality. The other thing we look at when we're determining sleep quality is daytime functioning, and this is basically just how do you function the next day after you sleep. And this is particularly to do with, do you feel like you had a restorative sleep overly? Do you wake up and feel like, okay, I'm ready to start the day? Or do you feel like I'm still exhausted, I still need a few more hours of sleep, and you turn over the bed and continue sleeping? So daytime functioning will include things like your cognitive functions, how you're able to basically pay attention within your circle, if it's at work, if it's schoolwork, how are you able to basically make decisions, your memory off the edge, and just generally your energy. Yes. So we've talked about what entails sleep quality, good sleep quality and poor sleep quality. So the importance of sleep, generally, we have so many things that sleep can do, and lack of sleep may be our interfering factor. So sleep is very important for your immune system. It does impact on your immune system, and especially important during this pandemic. We know that there's a virus that has been yet to be studied, but has also been shown to be a bit fatal for some individuals. So you'd want to have your immune system on board, you know, like at all time. So it does impact on your immune system. So poor sleep quality does reduce your immune function generally. It also heightens brain functioning. That is things to do with your learning, your memory, your decision making, and that's because during the time for sleep, your brain is able to sort of rejuvenate and rebalance the neurotransmitters that are responsible for this, acetylcholine, for your learning and all that. So learning, memory, decision making, very important, because I mean, if you're in school, that's very necessary. You do not want to be in class and you're not gaining anything. You don't want to be at work and you're not gaining anything, because we are trying to improve ourselves as we go day by day. Sleep also enhances mood and energy. You do find that days when you have not slept too well, you may be a bit more drained or a bit more irritable. Someone says something and it just throws you off the edge. You just edgy, if you may call it. So sleep, yes, does impact on your mood and energy. Sleep also improves, or rather prevents mental health problems such as burnout, mood disorders, and anxiety disorders. And generally, these are problems, particularly with mood disorders. With depression, at times we have increased sleep or reduced sleep, hypersomnia or insomnia. And with bipolar disorder, mania, we do know that the patients do have reduced need for sleep. So sleep is quite important in maintaining good mental health. And of course, it's important in maintaining your general emotional wellness, as we've seen. So challenges of sleep in this pandemic. We've had disruption of daily life. And that's because, I mean, with the lockdown, with the new rules coming into place and curfews, we've just had a disruption in what was normal. I mean, for what you've considered normal for years on end, everything just became a whole new, I mean, what we've been calling a whole new normal. So people have been forced to get into new schedules, and some people, it's been lack of a schedule. Whatever schedule they had is not, or rather they cannot be able to fit the schedule they had before with the kind of schedule, the kind of changes that have been implemented. The other thing with the pandemic, we've had places where we have reduced social events. I think almost all countries, if I'm not wrong, but let me speak for our country here. Social events, social gatherings have really been limited in terms of number of people who can attend certain events, and generally social functions have been very few. And we do know that for some people, this lack of social events and social interaction does help with, rather can be a problem, because they use social events to help with relaxation. The other thing is with the disruption in daily life, we have reduced working hours, maybe because your company generally, or rather your hospital, cut down the number of hours, or it could be the fact that you're working from home, so the time it would take you to probably get to work or get from work, I mean, that is no longer an issue. So you have reduced working hours or reduced time that you need to dedicate to you working. And this in general can lead to oversleeping and erratic sleeping patterns. The other challenge of sleep in this pandemic has been anxiety. And anxiety has been there in all areas, starting from the fear of getting ill, and especially with the constant updates that we get. We do know that maybe they're not as intense as they were initially, but when the pandemic had started, we'd get Honorable Mutahi Kagwe talking to us every day about the COVID numbers, and for some people this would spark a lot of anxiety because the numbers keep increasing and increasing, and of course we do know that frontline healthcare workers are at a greater risk. And when the pandemic was beginning as well, we had patients who would not come and reveal, or rather would conceal information that they do have symptoms of cough because of the fear of being tested or just being taken to isolation. So there was the fear of getting ill. For frontline workers, I've been having the fear of infecting loved ones, and this is because you get exposed to a number of patients, and the fact that sometimes it's not overt, who may be having the illness or who may not be having the illness, you don't know. Like, you can go home today and you have no symptoms, your patients that you saw had no symptoms, you've been infected, and you infect your loved ones. They could be young children or even the elderly, maybe grandparents in the house. And so there's been that fear of infecting the loved ones among the frontline healthcare workers. And also with the frontline workers, their family members also get anxiety and fear of being infected by the loved ones. So for some people it did lead to isolation and the family members trying to alienate them when they come home because they do not want to be infected. And of course, this in turn affects family dynamics to a very great extent. Sometimes it may not be that obvious initially, but eventually it does bring some issues in the end. Anxiety also due to economic losses and fear of retrenchment or job losses. Companies have been closing, hospitals have been shutting down. It's been a space of fear. Like, you don't know if you'll wake up tomorrow and still have that job. You don't know if you'll wake up tomorrow and you'll be paid. And as we know, our country has been having a lot of issues with economic, particularly when it comes to healthcare workers. And so this has been a challenge and a space for anxiety for many people, and also it to do with economic losses and just the economic space. For healthcare workers who've not had a health insurance fund, you get scared, what will happen in case I have to go to ICU or I have to be admitted to hospital? Will I afford this kind of care? So there's been all that anxiety. And of course, when it comes to the hospital crisis, day in, day out, being told there are no ICU beds, there's no bed space. So of course, there comes the anxiety of what happens to me in case I fall sick. The other challenge that we've been having is when it comes to depression and feelings of isolation. So people who've had depression, feelings of isolation during this COVID time, mostly are the ones who have been sick, either have had a diagnosis of depression before, or the ones who've been diagnosed with COVID. And of course, as we said, given the news and kind of information the media has been portraying out there, sometimes someone can feel isolated or physically isolated, but also emotionally isolated by their loved ones. So those who've lost a loved one can also have feelings of depression. Those who've been isolated for prolonged periods, you've done your COVID test, the second time round it's come back positive after doing 10 days of isolation. So you end up being in isolation for another 10 days. So it becomes a very prolonged period of isolation. Those that live alone as well are bound to have depression because or rather are at risk of getting depression because they do not have people that they can confide in. And we do know that emotional connectedness, social connectedness is very important for human life. Yes, so, and as we know, depression is more than just feelings of sadness. It impacts on your emotional, your cognitive, your behavioral, and your physical health as well. So in the emotional, there's the persistent low mood, there's the extreme negative outlook to life, and just generally everyday activities seem like a torture. When it comes to the cognition, we have memory, impairment in memory, impairment in attention, concentration, judgment as well become a bit of a challenge on a day-to-day basis. When it comes to the behavior, people with depression have social withdrawal. They can be crying, they can be very irritable. On the physical health, depression can cause reduction in energy, extreme lethargy, increased or reduced appetite, and of course, sleep, what we're talking about today. It can either give you hypersomnia or insomnia. So the other thing, the challenge that we've been having when it comes to sleep and COVID during this pandemic is also when it comes to family and boundaries, people being in this prolonged closed spaces. At times it's very easy to find that boundaries are being crossed, and there are lots of friction from day to day, on a day-to-day basis within the family members. Then also we have excess screen time. When you find yourself having to check constant updates, news on the phone or news on TV, so you have too much screen time, wanting to know more, what has happened now, what has happened next. Also screen time to do with Zoom meetings, because a lot of companies and also meetings have been pushed from physical meetings and physical sessions to Zoom meetings. Sometimes even ward rounds were Zoom meetings in some facilities. So yeah, that can increase excess screen time. Binge watching, for those who love to binge watch, because you have a lot of time, you're indoors all the time, so there's a temptation to binge watch movies, Netflix and Showmax and all that. Then of course now there's also the stress-related fatigue, where you're sleeping and you're not getting rejuvenated because you are just extremely exhausted from the stress that comes with all this altogether. So on recommendations for good sleep, the first thing you need to do is set a schedule and a routine. You need to avoid major variation in terms of the time where you sleep. Between 9, you can decide to be sleeping between 9 and 11. Not one day you sleep at 9, tomorrow you sleep at 2, the other day you sleep at 7, the other day you sleep at 4 a.m. That major variation can impair your quality of sleep. And also, if you have a wake-up time, avoid snoozing. I know sometimes it can be very tempting to snooze your alarm in the morning, but it's important to avoid snoozing so that you can keep to a schedule and a routine. When it comes to wind down time, that is basically the time just before you sleep. You need to dim the lights. If you have to, put on your sleep attire if you do, and sort of you're just preparing your brain for that time, like preparing it. It's time, it's about time that we need to rest. Then you also need to get off your gadgets at least an hour before. They have said that blue light affects our sleep. So you need to get off the gadgets, laptops, phones, TV, yes. The other thing is during the daytime, it will be important, while you set your schedule and your routine, during the daytime, also get out of bed, shower, have balanced meals, like live your day the way it was before, or rather have a schedule for that day so that at the end of the day, your body understands, okay, we did this during the day and now it's time to sleep. Also need to reserve the bed for sleep. Yes, especially if you've been working from home, please don't work from the bed. Make your bed once you wake up and go and have your meeting or your Zoom meeting or whatever it is, assignment or project that you're doing away from the bed. The other thing is to to avoid watching movies or series, or rather using any gadgets within while in bed, and social media as well. And you know, it's usually tempting. We pass time on on social media while we wait to fall asleep, but that is not good for our overall general sleep quality. The other thing is to spread your bed and make it more appealing, like more sleep appealing to your mind. Your mattress, your beddings, make sure that it's clean and comfortable. Yes. The other thing is avoid daytime naps, and or rather, if you have to, limit them to 30 minutes. There are people who take naps to try and rejuvenate their brain for whatever reason, and they do work. But if they're less than 30 minutes, anything longer than that will sort of disrupt your sleep cycle. Try to stay active during the day. You can do exercise, whether morning or evening. It's important to understand your body. For some people, exercise works better in the morning. For some people, it works better in the evening. The other thing we need to do is practice kindness and foster emotional connectedness. This helps to reduce stress generally. If you practice kindness and go out of your way rather to just be kind to people, it sort of gives you happy emotions and happy feelings, and that generally reduces stress. It's also important to promote positivity, but be sure not to have toxic positivity where even when things need to be solved, you're still, okay, it's life, you know. So be positive, but not to an extent of toxic positivity. Then maintain social connectedness, as we've said, even while we are practicing physical distancing. The other thing we need to do to enhance good sleep is to use, or rather utilize, relaxation techniques. For those who can do yoga or meditation, it's very important. It helps you relax. For some people, calming music, of course not the boom boom twaffs at night, calming music can help relax your brain and of course give you shorter sleep latency and of course a better sleep quality at the end of the day. Also, as we've said, reduce time on social media and time for watching updates about the pandemic, and if you have to, definitely use trusted sites. One thing that you can never ever forget is a healthy diet. Healthy diet goes a long way in all aspects of our health, physical, mental, all aspects of our health. Healthy diet, a balanced diet goes a very long way. Avoid caffeine, avoid alcohol, avoid marijuana and other sleep enhancing or sleep depriving medication. In case you have sleep problems, either you're not sleeping enough or sleeping too much, do not hesitate to seek the assistance of a healthcare provider. You can seek from a psychologist, a psychiatrist, even just a general, your general accident and emergency, the self-referral system, or rather the referral system. You should be able to get assisted some way or another. Do not self-medicate. I know as healthcare providers, we do that a lot. We self-medicate, alprazolam, and all the other benzodiazepines, and many other medications that we use to try and get ourselves to sleep before we actually get to the point of seeking care and actually getting help for the cause of our sleep problems. So remember, early assessment, diagnosis, and treatment comes a long way in promoting recovery. Don't forget that. And I wish you a happy sleep time, and thank you for being a part of this session.